Start.
Hello, good afternoon, everyone. Myself, Dr. Navjot Trivedi, the Dean Faculty of Physiotherapy, Parul University, Vadodara. We are very happy to welcome you all on this webinar. The series of webinar to improve our own skills in physiotherapy. Today's webinar is on critical thinking and clinical practice, the need. And the resource person for today's webinar is Professor Dr. Priyanshu Rathod. Sir is a professor and director of School of Physiotherapy, RK University, Rajkot. Sir is an expert and he has taken a number of expert talk in various conferences and workshops in India and internationally. And Sir is very much prepared for today's lecture and he is going to give you much more insight on what we can do as a physiotherapist in this situation. Also, he is going to explain that what are the new ways as this lockdown has opened for us physiotherapists. Sir himself is a PhD guide and he has done his PhD in telephysiotherapy. So he'll be sharing with us also that now how much it is helping in this lockdown situation. So I request Dr. Priyanshu Rathod sir to continue with this topic. Sir, please welcome you to on this webinar by Parul University Faculty of Physiotherapy.
Thank you.
Please, sir, you continue, sir.
Okay. Very good afternoon, and thank you, Navjot. It is a wonderful opportunity to be a part of such knowledge exchange, and yeah, that is quite fine. That it is a time to have utilize in a proper way of learning and teaching our students, our fellow colleagues, and knowledge exchange. I hope my friends must be able to see the starting screen.
Yes, sir, it is visible.
Okay, I just go for full screen. Okay, I think it's fine. Navjot, it is a full screen.
Yes, sir, it is full screen. Sir, that's sharing one now. Next to that, it is written hide. Just hide that small.
Okay.
Done, sir. Perfect. Perfect.
Thank you very much, Navjot, and welcome you all those audience, those who are in timely available at 2 o'clock for this webinar. And I'll make sure that you have a wonderful learning and exchange in the topic called critical thinking in clinical practice, the need. Yes, myself, Professor Priyanshu Rathod. I am a Dean Faculty of Medicine and Director School of Physiotherapy, RK University, Rajkot. And the objective of this today's webinar to understand and learn from the changes resulting from the impact of COVID-19, to develop the critical thinking from our past clinical practice and present situation for future decision making. So the interest is all about that we are going through one of the uncertain time of our life that we do not know what is the next. And my topic for objectives of today that I'll make that our profession all have a wonderful contribution, even and a lot of learning from this situation what we are facing today. So once again, welcome to change. So social distancing, it is always matters a lot. But we have to get ready to see the new world. It is not what we have seen before January or before 22nd March of this year. So lots gonna change. Probably we'll observe from this present situation. So I have a prepared one kind of presentation where you understand that positive and negative changes brought by COVID-19. So let's start with what are the positive changes brought by COVID-19. Definitely the blossoming nature, birds and animals having good time, and value time for family. There's a picture what you can see my father, my kiddo, Naitik, my mother and my wife. I think that after a long time we are spending full day together and having lots of new board games and things are happening. Always we have seen ourselves in a very fixed routine, and so we call very planned people who wake up in morning and run to the our job and commuting, and everything was very much fixed routine. But you'll surprise that every one of you, including entire 185 countries of this world, have totally new routines from this COVID-19. Even there is a lot of advices we have been said by our parents and our teachers and our fellow and all those medias to eat healthy and stay healthy, have lots of fruit in our diet, exercise, wash your hand, drink a lot of water. We never taken so much serious, but surprisingly that health and hygiene has become one of the very important part of present situation. Major life changes in a lifestyle which was lacking in our prescription. If you just recall the very few time you observe the doctor is prescribing that you take healthy food or go under sunlight, have a warm water in your morning, have clean your hand properly. Those basic advices never been prescribed so far, and this is one of the situation where we are suddenly flooded with those guidelines, and definitely we do appreciate it. One of the positive changes brought by COVID-19, it is innovation, startup and entrepreneurship. Though we are so prepared that within 10 days of time, some of the mechanical engineers, the doctors, they have prepared one ventilator, and they have guaranteed that they'll provide 1,000 ventilator if it is needed for India. I just don't want to say that innovation, startup, and entrepreneurship is just for technology and science, but it's for humanity also. People are devoting the time and energy. Definitely, it's me, and I do enjoy a lot the e-learning and teaching. I have started phone call, much WhatsApp-based free physiotherapy services, and surprised that every day I have minimum 10 OPD I run by telephysiotherapy. It is a just contribution to society. I don't charge. But nowadays I realize that once this lockdown gets over, I'll start charging money also. This is one of the example of positive changes that the just help of the WhatsApp. Yeah, here is my kid. I cannot stop him. So he's here with. So positive change about that. Just a blow from the WhatsApp, and we can see that a lot of people exchange about patients comes and say their questions, and experts they give advice. So WhatsApp is one of the media they have found the number of patients are utilizing their basic need. Expensive use and information of communication technology we have observed. That is one of the positive change brought by COVID-19. Exclusively education got impact. Even though it was the holidays and schools are shut and colleges are not functioning, a lot of education happened. And I think it's happened more prospectively. Learning for the students as well as for the faculties. Lots of new resources came into action. People learn the new method of learning. Online education, new technology become much more easier for adopting. It is not about the one application, but the hundreds of applications came in action. A lot of students realize that so many free courses are available online. So many certificates been taken and knowledge has been shared. E-health, definitely e-health has a huge impact. And I have personally realized that as being a physiotherapist, it works very effective. Probably I don't have much of time to spend with the patient, but just simply sharing the information on WhatsApp and video clips of GIF, clip of exercise, patients are finding very effectively. E-business, definitely there is impact. So this information and communication technology business are not just even disappeared. They also exist. A lot of things are happening as it's supposed to happen. Entertainment and social medias, which has taken a great effect. So definitely I appreciate those resources which are working to provide the knowledge exchange. Just some of the negative changes brought by COVID-19. Okay, this is my kiddo. He's want to talk. Okay, please. I'm talking. Please. What are the most negative changes brought by COVID-19? The world has fundamentally changing. I think there's a change. Predictability from unmanageable disaster. You can see that this stadium was prepared for Olympic, and now it has been used in the other way around. You can see the roads are empty, which is running for 24/7, and hundreds of vehicles in every second and minutes become empty. We never thought such situation comes in action. Action. There are a lot of mortality we never thought about. It is more than the Second World War. We have 1.5 lakh mortality just in 2-3 months of time. The negative change, what I have observed, that some of the challenges have surfaced for modern medicine. So much dependency has uncovered. Money spending capacity may compromise with the economy. Probably we face some challenges in next 3-4 months and maybe a year or long. Major critical changes in the lifestyle through the process, thought process, policies and planning. And the lesson to learn from these changes brought by COVID, it is very important thing. I think we always are positive to learn and think what happened around us. Positive changes and negative changes I have kept in both the category. Critical thinking helps for decision making. Critical thinking helps for decision making. Let's have something more in a different way of it. Life during the lockdown, critical thinking. I have expressed some of the case study where we can understand these challenges. What will be consequence to permit online shopping? Advantage during lockdown, people are happy to have a online shopping. It was thought that if the government allowed to have a services, people are happy to have a online shopping to get things at home. We're surprised that this situation was very critical, where we observe that if poor situation with local vendors and retailers, the situation will be very difficult for those vendors. If consumer learns e-shopping, future of local vendors and retailers will be critical. And definitely government has taken an appropriate effort for the same. Second case study, will you go to buy a new car or house after lockdown if you have planned earlier? Let this situation to get stable. This is the commonest response you observe from the people. Let's change the economy and spending power. We take some time to think about the new purchase of investment or money in other way around. One more interesting thing about what will be the impact of lockdown on the rate of daily patients consultation in Rajkot city. I think you spend some time. It is very interesting analysis what I just thought of it. Total population of Rajkot is 16 lakhs. Total doctors 500. Just guess, total doctors 500, including allopathy, Ayurveda, homeopathy, physiotherapist, everybody. And everybody having 20 patients consultation per day. So it goes every day, 10,000 patients get treated or consulted in with the doctors. Just think about 25 days of lockdown. So 2.5 lakhs consultation could not occur. So what is my message here, that just because of this 25 days of lockdown, the 2 lakh patients not went to hospital or clinic to get treated. So the interesting thing comes here. If patients have managed themselves at home, then things will be different after the lockdown. So many patients has learned themselves how to manage with the pain, discomfort, how to take the home remedies, how to use telecommunication, how to take care of themselves to go to have critical care. So this is just kind of thought. Probably this situation may come. The patients say, okay, I'll take care of myself. I haven't gone to 25 days, I have managed. I can manage more with my resources. There is one more case study. The patients are afraid, as the doctors are afraid to patients. Once lockdown will get over, we have to be very, very careful. The certain needs to change in the approach at the both end. Patient has to be very careful about doctors or institute or hospitals and clinic where they are visiting. It won't be as it was before lockdown. So we have to think critically that what situation will come. Do the patients come so easily they used to come before? What health and hygiene we have to take to attract the patient, or patients also require that this is a place they're having a very good disposable thing. They take the mattress, they change the mattress, the youth doctors are wearing gloves. So everything will be calculated from now for next at least 6 months to 1 year. Lots many patients are asking about the quality of clinic and hospital already when they go to trauma centers. Case study is one about e-learning versus classroom. Probably we all are at present, we are doing e-learning. Probably, I'm managing maybe the thousands of people at present, and you are at your leisure place at home, must be watching TV and having cold drinks and fun and food at a relaxed situation. Stay home and learn. It is a new concept as bought from this COVID-19. You have saving money from living in hostels, food bills, transportation, and other fees probably when you stay in hostel and learn in other city for your education. Attend institute only for practical learning. Maybe the new concept may come in future that people just think about to attend the college physically for just practical learning. They can manage such kind of thing at home. E-teaching and is have one of the great advantage probably you observe, and I have felt as a teacher that I can mute my students very nicely. If I don't want, see, this is a time I have a pin drop silence. You people are managing so much peace that if that's not always possible in classroom teaching. Sometimes your disturbance and noise are well minimized. If somebody having question, they can raise and I can attend that. So that's one of the advantage of e-class. You're surprised that the Stanford University has released one data sheet that 1/3 of, I think 1.5 times more students have enrolled on online learning as compared to the present status of the students. But there is also negative challenges. The face-to-face learning is more meaningful. And so many people like you are happy to go to institute rather than learning at home. Having friends, having chat time, and something change is also needed. But question comes that if e-learning become a big outcome of this COVID-19, then what about the institute and university established with on major pillars? But I think that maybe there is a equal stability and balance will come. A lot of practical skills require face-to-face learning. Research definitely require institutional based research, laboratory based work. We have a physiotherapy in critical thinking. Can we do research? I think it is very interesting part. Probably it is just hypothesis, so consider as a kind of thought to regenerate. Can we do research on use of ultraviolet germicidal irradiation for minimizing the impact or deactivating the COVID-19 effect? As we know that we are using UVR, so why not UVC? Ultraviolet Germicidal irradiation is a disinfection method that use short wavelength ultraviolet light to kill or inactive microorganisms. By destroying the nucleic acid and disrupting their DNA, leaving them unable to perform vital cellular function. We know this and we have ultraviolet facility in our clinics. But my interest here that can we think about that this could be one of the point of research in killing those microorganisms and work as a sanitizer, or somebody can work extensively to have overcome to the COVID-19. That is just hypothesis. I don't want that you just start doing practice, but think about this research idea. Definitely could be prospective. We are practicing the UVC and UVR since so many years. One more idea here, probably you can think of it. If COVID-19 gets disintegrated at 42 degree plus Celsius, how SWD will be the effective mode of intervention? Very good friend of mine, Dr. Ramesh BV, he is in Bangalore. We are just having chat before this presentation also. And a lot of things what you observe, we had discussed that if we are using diathermy and if that virus having a impact disintegrated at high temperature, as a virus is made up of protein and we can denature at 42 degrees Celsius. So what's wrong to have use a diathermy to kill these viruses, or maybe to minimize the effect of viruses? Temperature threshold of brain to function, it is very important thing. It is just hypothesis. Don't take it as one of the research topic immediately, but take it as one of the thought process. Because some of the equipments what we are using, light and physical equipments, having a direct effect on such kind of organism. You know that the UVR been used so many years for tuberculosis organism, but we have to start thinking in a new way of it. There is one more interesting areas has come out from this COVID. You surprised that the so many years we are dependent on the chemical biomarkers, and suddenly last few months you observe that we are dependent on physical biomarkers. The fever, frequency of cough, dry cough, running nose, sneezing, headache, those all are physical biomarkers. Skin rashes, fatigue, difficulty in breathing. We were surprised that we were dependent on chemo biomarker. Somebody get fever, go and get the blood investigation. Go and get the blood report. Go and get the CT scan MRI. We were dependent on such kind of chemical biomarkers. But just for 3 months, we have a physical biomarker on hand. Everybody is holding the gun on forehead and check the thermal temperature. Oh, temperature is higher. So definitely we have observed the big change of chemo markers to physical biomarkers. So here is a what exactly it comes to the matter that critical thinking in clinical practice, it is a needed. What we are practicing so far and what we are situation facing now, we have to take lesson for future execution of our practice. It is not only existence is matter, I said earlier. People have learned to manage themselves at home. How good practice we will do that we start functioning well as earlier after 1 or 2 months of this lockdown. So critical thinking is a skill. It is analyzing, the communication, open-mindedness, problem solving, and creativity. You have to announce that you come, my clinic is disinfected. You do the sanitizing every day. I use the disposable material. My coach and my therapist and everything I change after every patients we see. So this thing gonna be coming in once this lockdown gets stopped. I'm sure that you must have thought about it. I think before we go to this the physiotherapy perspective in clinical practice, I have some of the examples. It is from the past. It is not from the present situation. And I want that those past examples, we have to study very, very carefully to understand, to have a critical thinking for future decision making. We, as you know, that ophthalmology is before 20 years, ophthalmology is much more about cataract and glaucoma and very, very basic areas they were practiced. For last 20 years, just to have a LASIK, they have changed the entire profession. Not only the retina, but number refractory, everything they are managed with the new technology called LASIK. The dermatology has changed their practice from eczema and normal skin disease to cosmetic. With this change, it is required. Definitely, you know that anesthesiologists before 20 years and today they take care of ICU. There is a transformation. The biggest change has come in radiology. Before 10 years, hardly we used to observe the MRI and CT scan. But see, the radiology has changed from the root. It was some X-ray, CT scan, MRI, PET scan, and now it is an intervention. The endovascular intervention is much more taken care by radiologists. The same syllabus, same duration of 3 years of Masters of Medicine, people are practicing with advanced areas of intervention. And I won't be hesitate to say that OBG has changed, we never thought about it. IVF, it has been just before 10 years, it is hardly we have heard the name. Obstetrics and gynecology was, though it was very efficient profession, but IVF changed the way OBG we have seen before. Physiotherapy as a profession. I would like to highlight some of the areas. I'm sure that everybody must be aware about it, but we are myologists, we are movement scientists, we are exercise physiologists. We are dealing with one of the largest human organ in the body. It is the muscles. People have brain and people have a bone, people have a kidney. We have a large muscle system. Movement is a life. If human cannot move, it's difficult. And we are here to make a movement possible. Our treatments are every day, weeks, and even months. Some of the clients come for years and years, cerebral palsy and stroke. They see we don't go to school, go to college every day, but our patients, they don't miss one day if their improvement is little bit from the flexion or habit to hold something on a hand. I want you to consider all these things when you decide in the future planning. We have a reference from the super specialty, neuro, cardiologist, orthopedist. As being a bachelor degree holder, we get the reference. We need some people get support, the neurologist reference to the hemiplegic patient to physiotherapists. It matters a lot. Neurological, cardiopulmonary, orthopedics, and many super specialties where we are the caretakers. We have a wide area we are practicing in the world. Once again, let us see having some physiotherapy in critical thinking. The need of walking sticks, just the need of walking stick and tripod. Is it for much support to use while walking, or stick cannot stand or rest? We have a tripod. You think that the people are walking and having a stick is sufficient, unipod. The reason why to have a tripod, 3 legs or 4 legs, it could be because of the person want to do something and stick do not fall. To prevent the stick to fall down, maybe there is a tripod or quadruped, but maybe there is a point of interest. We had a Mahatma Gandhi used to use one stick, bamboo stick, and it has so many purpose. Lightweight, hardly maybe you can find some 20-30 rupees. It's a cost effective and there's a multi-purpose. You can hold at different angles and nothing to worry about if it is a zero maintenance. The stick, what is being used. But we are very much used to having tripod and quadruped and other kind of walking devices. It's just matter of thought. If muscle strength is grade 3, then why to strengthen the muscles? It is just simple concept. Don't get confused much about it. When we do the muscles grading of OA knee fellow, and the person is able to do the knee extension against gravity, then why to strengthen the muscles? Don't you think the grade 3 against gravity, you can walk and you can do activity of daily living? Why do she needs grade 4 and 5? If the grading is appropriate, needs to identify other underlying dysfunction. In my concept, grade 3 against gravity, you can walk, you can do activity of daily living. Maybe the grade 4 and 5 he needs to improve the strength for climbing the staircase. Maybe some kind of weightlifting he needs. This is just matter of thought. Let's see the best way to strengthen the quadriceps. Physical versus functional strengthening. One of my very favorite topic. Most of the time, we try to strengthen muscles with physical measures. And a lot of other way we can do functionally. You can see in the picture that we have static quadriceps been practiced for so many years. I have been taught by my teacher. Put the pillow under the knee, press the knee, and count 1, 2, 3, 4, 5. Hold and relax. We use the weight of 2 kg, and then we do high sitting and we do SL. When we do the leg raising. And we know that we can do half squat. We can do half squat even when standing with one leg. One leg, we can do half squat. That means that we can lift the entire body weight on a knee joint. Then why to have a put 5 kg and 10 kg on ankle? There is a matter of thought. Is it the strength is responsible or biomechanics is responsible for the challenges or dysfunction? We have one more example, exercise prescription for home and patients adherence rate. I have observed, and probably everybody knows that exercise prescription delivery always a challenging. When we teach the exercise, most of the time patients forget once they go to home. And it is a time where the patients do not do the exercise the way you have prescribed. And it's very injustice if physiotherapy start prescribing, do the treadmill and do the weightlifting and do the cycle ergometry and walking. It could not be a part of physiotherapy practice. Anybody can advise about a healthy lifestyle. So exercise prescription is very important part of it. And I would like to tell you that when you start after this lockdown, you take the exercise prescription very seriously. In telehealth physiotherapy, I observed that I have one research work to share with you people. Probably, yeah, you can see that there is one impact of telehealth for home-based exercise program. You can see my student Kruti Desai, who did this research work where we have 3 groups of people, all the neurological chronic cases. We have used clinical-based, clinical setting-based educating the people for home-based exercise, home exercise program. Another group, we call by phone and confirm that they have performed the exercise at home or not. In a third group, we have called them and seen them on an audio video, and we have corrected them for exercise. So in a 3 different group, we have practiced and we have observed that just having telephonic or even audio video, there is a 90% of adherent rate. Just calling the patient at home, that morning what exercise I taught you, have you done it evening? Just making one phone makes big difference. The patients feel comfortable. They find that, okay, I have it done. My doctor has called me. If I have missed, he will call me tomorrow. Just calling will not take more than 1 minute to 2 minutes. You can have some physiotherapist who does this job, like telecaller, to call the patients and confirm that they have done exercise or not. You're surprised that the 23% of improvement in therapeutic outcome among patients with neurological deficit, as compared to patients who advise the home exercise at clinic. Just making a call to the patients, And audio video, we observe the patients having a outcome measure based improvement was more than 23%. 40% of highest rate of satisfaction. This is very important thing. We have realized that with the telehealth, the patient satisfaction rate is dramatic. We have not stopped them coming to clinic. Every day they come to clinic, only we call them in evening, call them in afternoon. Do they have, do you have done exercise? Let me see the exercise. We just wanted to correct them. And we realized that after calling for 3-4 times, they always perform the exercise perfectly. So my interest here about that exercise prescription matters a lot. So many times you observe the patient do not perform exercise properly. We have to prepare the papers and exercise diary and kind of short GIF videos, which is needed nowadays. And I think it is a time to start. Now, another areas, artificial intelligence and virtual reality for future practice. It is not impossible. We have to start thinking from now. Can you realize that what our patient must be doing at home? Those who used to come every day. What about those city children who used to come every day? What about those chronic disabled people, Parkinson people? What will be the situation? What they must be doing at home? Here is your solution. You must equip with telehealth. You must equip with virtual reality. Involve the patient. So many applications freely available on mobile that one Parkinson fellow can practice at home. How many of you, how many of us have called our patients? They used to come every day at our home. Every day used to come at our clinic. And believe me that if you are not connected with them, you should call today. Because it may be they are in need of your support. We have to call them. But future, be prepared with advanced technology that you should not stay away from your patients. It could be AI, it could be virtual reality, or it could be telehealth. I'm very much sure that there's so many support from the free technology what we have. Google, Microsoft, and what we are doing now. The way simply I'm interacting with you, I'm interacting with my patients. Every day patients are waiting at 10 o'clock, 10:30, 11 o'clock, 11:30. I thought that I start this telehealth maybe in some time when I get holidays, but this is something what I taken from this opportunity of COVID. And I realized that all those patients were badly needed to have physiotherapy. So please stay connected with your patients. COVID, physiotherapy and critical thinking. Maybe once you get back to your institute, your clinic, think about what you can do in this technology world. Because only one thing could sustain in the entire world, it is a technology. Electricity, the same way we have internet is functioning. We just cannot go outside our home, but we can see everything in our fingertips. We can access the information, we can learn, we can train. Then why can't we do some kind of use of technology? We can prepare the gadgets and monitor our patients at home. These are the areas it is needed. It is not just need of preparing ventilator and 10,000 rupees, but it is a need to be very cautious in future that we may need telecommunication-based intervention in physiotherapy. Don't just depend on physical examination. There are hundreds of things are available which requires not much investment, and you get those equipments to treat the physiotherapy. And definitely we have a number of resources. Today I have a say with so many of my friends about this link of this webinar. So we can connect the entire world. The global network is so much efficient that we get to know what's happening in USA within a second. Research, publication, information, and materials are on your fingertip. We can do everything with this social media and networking. We can learn, we can train, we can treat, we can do lots of things. And believe me that I want a few of them after this session think think critically that if you can make a future in this telehealth, can you make a future with your physiotherapy, with information and communication technology? I am most welcome to help you out. I have some very nice past prediction and what the change brought by COVID. It is a business, one of the magazine by the 2017. Somebody has updated that 85% of jobs that will exist in 2013 have not been invented yet. I think it's what Dell was the company where the statement has come. Get ready for globalized workforce and a lifetime for retaining, retraining. Report from the Dell 6. It is very interesting. Probably next 10 years, we do not know that what exactly the way we are giving physiotherapy may not exist. And I think this is the starting of 2020. Probably this statement came in 2017, but not by 2030. By 2025, we'll find the 80% of job that will exist will be different than what been invented so far. So I request all of you, this is the most wonderful time you have. Utilize in the best way of practicing. And my best wish is to take leader in all those areas. Don't feel that. If it's the UVR, if it's the diathermy, we can do a lot of things in research areas. So once again, thank you very much for listening to me. And I really congratulate the Parul University for giving me opportunity. And if there is a questions, probably it has been live telecast, then definitely I would like to address. Here my email ID, you can make a note of it, and I'll reply you in my email. So once again, thank you very much for spending some time in a very hot noon. People trying to be asleep and take nap in this holidays or lockdown. You people are here to listen to me. Thank you very much. I think it's over to Dr. Navjot Trivedi.
Good afternoon, sir. You can close, stop your presentation, sir.
Okay.
Stop presentation.
Yes.
From right corner.
Yeah.
From where right corner?
Okay, I did.
Thank you very much, sir, for the amazing lecture. And like now the ideas has got open, that there are number of possibilities and there are number of ways a physiotherapist can do. And talking about different modalities also what we can use really, sir. And that is going to be a very effective in this COVID-19. And like what message you have given, that has filled a lot of positivity and motivation in us, that physiotherapists do have a great role. As sir, under your guidance, I have done my PhD in disaster management. So I remember it very well. There is a very big, huge role of physiotherapy in these disasters. And they can do a lot of things that I have already published, but that can be discussed later. Sir, some are physiotherapists which are new, those who are students. And, before we used to think either we become a teacher or we go to the profession. But how do you see now a new thing open which we can guide to the current students in final year or in MPT?
See, I think in our course, we have syllabus which has been made by the in a very broad syllabus we have. But we are very much fortunate that we cover the entire human body. And one of the things probably we need to get involved is the technology. I always advocate that we have a mobile. Everybody is using mobile. Probably they go to washroom, they go to bath, they go everywhere. If they forget something, but they don't forget the mobile. So a lot of things can be done. If so many application has come in nowadays, the people are getting exercise and learning training from the mobile-based technology. So I think I'll be wonderful if audience are listening that if you can create some kind of a frequency and intensity from mobile can work as a interference for providing TANs to the person. So TANs can be given by the mobile. Even your computer can work as a technology for EMG and CV. You know, so a lot of things can be changed in this world of technology because distance are matters a lot.
Agree, sir. Right, sir. That is an advantage, or that is something they need to learn, right? And I think we need to upgrade little bit on our education of physiotherapy so that new instruments modality can be generated. And this is a learning session for us that what actually we need more and more in improving our field, sir. Right, sir.
One
Thank
thing
you.
probably, if we have a time, I probably feel that the critical thinking, it is a, we have our books and our teachers are so nice that we have, if a exercise program for ONE is well designed. So sometimes, before the patient is coming to the clinic, we decide there is a diathermy we will give. We have a very prejudice and fixed mindset of certain exercise, certain therapy, certain modalities. So this is the right time to critically think that it is not just about the giving a treatment, but examination is also important. And a part
Agree,
of
sir.
this, a part of this critical thinking in our practice, when I even I couldn't do that, but we are seeing so many sanitizers. People at the cubicles, they walk throughout the cubicles, and there is a spray of what you call the sanitizer. I want that if somebody, if you get chance, they can prepare the UVC based sanitizer, or something can be done from the physiotherapy side in kind of innovative in practice. May not be 100% of effective, but definitely it's enough to kill those bacteria, not even virus, but bacteria for future practice. Thank you,
Agree, sir.
Nojul.
Thank you so much, sir, for an amazing lecture and opening our eyes more. Or there are a lot of things we can do it here. Sir, even I was the one who used to get afraid from webinars and all that, how it is going to be. But now this has made us that if you really want to do, nothing is impossible, and everybody can do and put their maximum effort. Thank you so much, sir, for improving our insight. And I will like to tell all the audience that by today evening we will share this on YouTube channel. So those who could not join on time can again revisit the whole lecture from starting till the end on YouTube. And we'd like to thank you so much. Please do comment on YouTube on ask question, though we can answer on time. Thank you so much, Priyanshu sir, and thank you so much, everybody. Thank you, sir.
Thank you.
Uh, yes, sir. I'm going to stop the recording. Thank you.
Thank you. Good day. Shall I leave the call?